Very good morning. I think once again, it's been very happy to see you all. This INVT Industrial Empowerment Session. And also thanks for the support which you have been giving throughout this year. Actually, this is the 40th program, continuous program, which has been incorporated by INVT Training Wing. INVT is being founded by alumnus of College of Engineering Guindy, IIT and RLI in a vision to ensure that technological incorporations have been incorporated in the fields of safety, quality and technological innovations which has to be take place in the industrial sector to ensure quality, saving a human life and also incorporating new technologies which has been there throughout the world. Today, yes, the training wing from INVT, they have been arranged this webinar. I think this is a continuous 40th week. They have been arranging this webinar. The topic today, which has been given for us, is one of the very interesting topic. Last year, once this COVID outbreak has been happened, our Quality Council of India, QCI have been formulated this WASH standard, such WASH standard. What is WASH standard? Whenever our audit team has been going for ISO 45001 audit, or it may be of a kind of IS 14489 audit, our auditors have been came across how we can able to incorporate this COVID protocols, because COVID protocols, yes, there are COVID protocols have been there. How to induce or how to make sure that we have been including this COVID protocol, COVID measures into this. So today we have been this week INVT Training Wing have been given an opportunity for me to discuss about this workplace assessment for safety and hygiene. It's one of the proactive measures, because in this 2 years, a lot of standards. I think even our ISO 45002. If you are having, I think in the coming days we can able to see that standard also. They have been given some guidelines. What is the use of this? You can able to ask me, sir, what is going to be the use of this? How we can able to ensure that we are going to be use this standard? Yes, we are going to use the standard in such a way that how it has been prescribed, how we can able to tailor made without leaving out any important topic. That is one of the very important topic. Yes, before going into this session, I thank our R&D team, INVT R&D team, who has been contributed and came up with a COVID smart CCTV. And very interestingly, last week you could have been saw the message from the INVT wall, INVT, the social media handles in such a way that they have been going to do a project, research project, to give a kind of waste, to have a kind of waste for our bull Jallikatti Veerargal. For that Jallikatti peoples, they have been going to develop a kind of waste which is being impact proof, so that we can able to avoid the kind of fatality which has been happening. Now we have been seeing that. So this is one of the things which has been it's not the standard which INVT has been invented. It's the standard which has been given by our QCI, Quality Council of India. The main important thing here is, my dear friends, my dear participants, before the kind of international standard which has been laid down for this COVID, our peoples have been came down with this beautiful standard called WASH. So we have been going to see this standard. So what are the things we have been going to see today is going to be the kind of these pillars. There are 15 pillars are there. So we are going to see one by one. Before going into this, the first request, the humble request from INVIT team and also for myself, I'm Satya Narayanan. I've been a part of this COVID, this INVIT training wing. So the first request from myself, which I can able to tell to all my participants is always make sure that identify the COVID frontline warriors. How to identify that? It's not the security persons or it's not the emergency team. It should not be in that way. Yes, they can also be the part of it, but how we are going to treat them, how we are going to provide them the psychological counseling, how we are going to ensure their food, how we are going to ensure their well-being. There should be some extra care to the peoples who have been chosen as a COVID frontline warriors. It may be safety officers, it may be our HR peoples. Yes, we are also a COVID frontline peoples. What is the extra care we have been taking on? Many of the kind of organizations now we have been seeing that a lot of active measures have been taken. But what we feel is, yes, we are doing all the active measures. What about the proactive measures? What about the proactive measures? Can we able to identify if, for example, in my factory, there are 4,000 people, can I able to ensure that by undergoing a kind of medical examination, easily I can able to tell about their immunity power? Yes or no? Nowadays, technology is being much superior. Even some of the organization have been done this also. Okay, you can able to see, you can able to easily pick the peoples who have been having less human. That too, who have been from this COVID frontline warriors, supposed to be in the COVID frontline warriors, if they are having the less human system, how you are going to boost them? You can able to boost them based on their kind of food habits, based on the exercises, based on the yogic practice. Something has to be done to concentrate, to give a focus towards the weaker or towards the section which can able to be easily affected. So are we doing that? Okay, you can able to have a thought for this. So the WASH standard, what is going to be the WASH standard? WASH is nothing but workplace assessment for safety and hygiene. Okay, this standard is being as it can be applicable for any workplace which is being which can be operated. It has been this WASH standard, even our Ramachandra institution, even our Ramachandra institution, even two of the organizations, I think one of the organizations from Bangalore, they have been done this. They have been got this WASH standard. WASH standard, is it mandatory? I'm not telling that you have to go for WASH standard, but my humble suggestion is you can able to see what are the parameters which been discussed here. Make sure, tell your a kind of MR, management representative, or you can also able to think upon how you are going to integrate this. How you are going to integrate this into your ISO 45001. Okay, that is going to be the biggest thing you can able to do it, because we can't be able to tell this COVID can be now, COVID can be able to end on tomorrow. Based on WHO, till 2025, something has been going to come on and we have to face that. So we have to be well prepared for this. The next one we are going to see about is what is the scope? What is the scope? What are the things have been not covered here? The scope which has been not covered. I've been requesting the participants kindly to put on mute to ensure that a proactive measure. Okay, thanks for that. So this standard is not saying about anything about the medical, about the kind of medical related things, what is going to be the treatment, nothing is going to be talked about. And also this standard is not going to talk about the quality, social responsibility, environmental, security, or financial management. All these things is not going to be covered under this WASH standard. This WASH standard is going to cover only about a proactive measures, a kind of administrative control, which is being researched and which has been accepted globally, and also at least in our country, many of the top institutions have been following this 15 pillars. You can able to see this. The pillar starts from management commitment. What is the regulatory and other requirement? what is the business continuity? Because these days, okay, nowadays 2022, after this third wave, everyone we are speaking about this third wave, every top management are not ready to stop the business. What we have been done on the COVID first wave? Yes or no? I hope you have been agreed with me. First wave, completely shut down. Second wave, we opted for that. Yes, we can able to wait. We can able to wait for another 10 days. We can able to go, we can able to wait for 10 days. Now, top management is asking us, it's not business continuity. We need business continuity. Yesterday, you would have been saw on the news that okay, England have been lifted all the things. Why? Is it COVID has been gone or this kind of pandemic has been gone? Not sure that they want the kind of business has to be done. Yes. For thank you, sir. Business continuity for our economic growth. We can't able to stop at all. Many people have been asked me, sir, it's going to be the third lockdown. Eventually, it is not going to be the third lockdown at all at any part of our country. We are not ready for it. We can't able to face the third lockdown at all. So business continuity, what you are going to have for your business continuity, we are going to see the documents. The most beautiful thing of today is going to be after the session, kindly fill all the feedbacks which is being going to be posted to you, the checklist, complete checklist, and also this kind of the presentation will be shared to you to the benefit for the benefits of our participant. Yes, sir. We have to, yes, we have been in line with the convention. Whenever we have been taking this kind of things, okay, whenever we have been going to have this kind of pillars, surely we can able to cover not only actively, proactive measures can be taken on. Next, about risk management. What about the risk management? Are we having a risk management? Are we having a risk priority number? Are we having a risk conversion? How we are going to reduce the risk? Next is going to be the communication. Next is hygiene and safety, preventive measure, training and awareness. Very important thing. We are going to see about each verticals. We are going to see in a very detailed way. Next, the waste management, ventilation, public interaction. How the public interaction is going to be. Next, the supply chain, transport management, document requirement, and control of discriminatory practice. Because this thing, I think we will see one by one, and we can able to know what is the use, what is the main focus on this. First pillar, I think this 15 pillars have been given. First, our understanding should be all these pillars have been given by WASH to ensure that all areas have been covered. Areas have been covered, and to ensure that in your documents, yes, as sir has been told, as many of our leaders would have been would be having a lot of formats for this COVID. Yes or no? Lot of formats. Good. After the session, evaluate that. What are the things I can able to add on? What are the things I can able to add on? What are the things I have been missed upon? Because nowadays I can't be able to wait for the things can be happen in my institution, in my organization, then I can able to take the action. We can able to always be a kind of proactive person. So the things can be, the first one is about, okay, the first one is about our management commitment. First management commitment is nothing but COVID-19 guidelines. Guidelines should be keep, because nowadays it has been keep on updated, at least to our top management. We have to ensure that a particular notice board, even we can able to dedicate this notice board for COVID information, and also the well-being should be continuously, it has to be communicated to our peoples about the regulatory term. Because nowadays, okay, last week onwards, our government is insisting about triple mask. Now, okay, I think before Pongal, they are talking about you can able to put 2 masks whenever you are going for the public gatherings. Now they are insisting 3 masks. Okay, are we having a system in such a way that this kind of all the information from our state and central health center have been going through our employees, at least, okay, not to at least it has to ensure, at least we have to ensure that it has to reach all our top management person from HR, from safety department, personal department. Next important thing is responsible senior. Who is going to be the commander for this all this COVID-19 protocols which we are taking. Don't tell our safety a person. Okay, don't ever tell that safety or HR person. Yes, sir. Proactive measure display board that should be there. Excellent. So, responsible person. Don't give this responsible to HR. Don't give responsible to safety person. Don't give this responsible to your top management. Why? Eventually, they are into the system. They are going to do that. Who is going to take care? Who is going to monitor? Who is going to guide this? As an advisory committee. As an advisory committee, who is going to look for, who is going to tell that, yes, until today, we did this, but it is not going to be active now. We can able to change this. Identify a person who is having the love. Yes, everyone is having a love and care towards our employees, who has been having more love and also they can always be a proactive person to ensure what are the best practices have been followed. Next, COVID SOP. About the COVID SOP, how we are going to define the COVID SOP? Already you would have been have the COVID SOP. The problems which we face whenever we are going for audit, the problems we face is many times whenever we are going to put one SOP, our participants or our employees always will tell that why I have to do this. What is the need for that? Whenever you are going to develop a SOP, make sure that you are telling as per which guidelines. So you can able to tell that person, my dear friend, our health department, Tamil Nadu health department is saying this, to take care of you, we are taking further more precautions. We have been taking further more precautions. So there should be a guidelines, proactive board, responsible person. Next, COVID SOP. A kind of COVID SOP should be there. Separate SOP should be there. Then the guidelines about PPE is very important. Guidelines about PPEs. What type of PPE has to be worn by what type of people? If he or she is going to be the frontline defender, what is the mask is going to wear? What is a kind of hand sanitizer? Hand sanitizing means, are we having hand sanitizer safety data sheet? Many of the firms have been not asking that. They have been they have been getting the hand sanitizer. Are we getting the safety data sheet? Are we asking this person how to use it? And also hand washing at proper locations. Always we have to make sure that a hand wash should be made sure that it is being appropriately placed at the right position, and also the social distancing. Yes, we are doing this. Next, about the guidelines about a effective implementation. Yes, we are implementing it. How we are going to monitor it? All these things about the PPE, about the sanitizer, about the hand washing, about the arrangement of the social distancing, and about a kind of how we are going to monitor. Everything should be there in your SOP. Don't go for a kind of complication SOP. Make sure that is a very simple SOP which is being keep on updating based on the current situations. Next, we have been going to see about the next one about regulatory and other requirement for communication process. What about the guidelines? What about the guidelines which is being prescribed, by our state government and central government? How we are the first, the kind of first pillar we saw about the updation. This pillar, how we are as a top management, we are aware about that. How we are aware about that? Are we aware about that? Who is the responsible person to collect all this kind of guidelines? Because nowadays it's keep on updating, keep on changing. Who is going to be the responsible person? Next, about the incidents. What about the incidents? If there is any incidents, how we are going to report? What is the format of it? What is the written protocol for it? Next one is the communication. What method of communication? If I'm not well, make sure that if 2 days back I went for an audit in an institution, in an organization. There, one person is keep on coughing. I've been asked him, sir, are you went to your health center? Are you okay now? That person is eventually not okay, but he has been afraid to go to the health center. Why? He's saying that Sir, once I've been going to the kind of health center without the consultation of my supervisor, it's going to be the big problem for me. Okay, it's maybe their culture, but what I feel is what is going to be the communication? Detailed communication matrix should be there. If I'm not well in my home, whom I have to contact? If I'm not well in my shop floor, whom I have to contact? If I'm not well, okay, and I've been looking for help at that time, a kind of serious help, whom I have to contact? A communication protocol has to be there. Next should be our business continuity. Very, very important thing. First one is resource identify. First one is resource identify. Yes, sir, acceleration metrics and also yes, the kind of acceleration metrics and also a COVID communication protocol can also be developed. If you're not feeling well, instead of going to health center, then they are doing all these things. Even you can able to make sure that if you're not feeling well, don't worry. Eventually, you can able to tell this person why this is important is a moral support. Okay, you imagine in our childhood days, whenever we are not well, even the kind of clinic would have been so nearer to our home. One of our family members will be accommodating us. Yes, now also they are doing that in our industries, but once it has been there in a return format, a kind of moral support. I'm going to tell to this person, yes, he will make sure that that person should be the kind of COVID frontline defender, SRO. That person should be a COVID frontline defender. Next one is resource identify, business continuity, a kind of business continuity. You have to ensure that what are the resources you need for business continuity, how you are going to deploy this resource, identification of supply resources. This is very important. This thing you can able to share with your top management too. Are you identify the critical resources or critical process in such a way that it has to be continuously, it has to be operated. For that, what are the resources I need in terms of man, in terms of machine, in terms of raw materials? If it is a raw material, talk to your purchase department, my dear friend. Yes, now we are going to see that a lot of things have been happening in our north side or the western countries. If you are going to get the raw materials from them, are you having an alternate source for it? Ask them in the ISO 9001 audit. I think class number 7 is asking about this. Class number 7 and class number 8 is asking about this evaluation about your suppliers, evaluation about your external providers. Ask them, because we are not going to ask for all the entire thing. We are going to identify only the critical process, and for that critical process you are going to ask them, my dear friend, are you having this? Next one is, for that critical process or critical areas, make sure that what is going to be the safe operation procedures, how the safe operation can be done. Many of the industries, yes, I too agree that this social distancing is not possible. Yes, social distancing is not possible at all. Yes, accepted. Yes, sir. Safety data sheet is being required, and also all the material apart from chemicals also, sir. If they are going to get any materials from other suppliers, what we are going to do? Yes, sir. Even the physical distance, yes, the social distancing, physical distancing may not be possible in many of the critical areas which you have been identified. If that is going to be the case, how you are going to operate? Yes, we have to operate that, but instead of, okay, I can able to spell you one of the industries which I feel that, okay, I can able to share the name also. It's not wrong because they are doing very good things. Our Delphi TVS, okay. Our Delphi TVS Varagadam, what they are doing is, whenever such kind of situation has been happening, every day they have been taking this rapid kit, okay, rapid test for that employees, extra care, face shield, all these things to ensure that, yes, this process, yes, sir, as you rightly told, yes, it has to be done. Okay, so face shields, yes. So face shield, and also we have to, the main thing we are going to see that, yes, we are providing here to ensure that it is one of the critical area in your industry. This critical area needs inspection, and it has to make sure that the protocols has been followed also. How the kind of frequency of inspection in this area. Yes, sir, human safety is more important. We have to ensure that, and also this inspection at the area where the minimum required, the kind of this social distancing or physical distancing is being not possible. Yes, they have been operating with kind of much engineering control, possible engineering control, and how they are going to ensure that, they are going to ensure that apart from other areas, I am going to have a inspection, no doubt in it, but in this area, frequency of inspection is going to be little bit higher to ensure that all the persons have been well versed and they have been good in the condition. As I can able to read it in a chat box, yes, human safety is the ultimate thing which we all have been working on. Next one is about the risk management. In this risk management, I think in our ISO 45001 also, there is a particular class which has been asking for this. Are you identify the risk identification? Class number 6, I have been asking about this. Integrate with this. How you are going to identify the hazards which is being related to the COVID based on environment, based on the material you used, based on the machines you used, even based on the peoples. You can able to ask me, sir, how you are going to tell, how you are going to put the peoples into this list. As I told you, as I started this webinar stating that, tell your top management to have an assessment on your employees about their risk levels or about their kind of immunity levels. The immunity of them is going to be less. They are going to be more hazards. They are maybe more prone to this COVID, not only COVID, for other things also. And also those people, the frontline warriors. Okay, the frontline warriors, they are also having a lot of contacts, our staffs, our HR persons. I think many of the HRs, our kind of safety persons, they are going to deal with many people. So they are going to be in the category. And you have to ensure, okay, you have to ensure that how you are going to reduce, how you are going to eliminate the risk. Can be okay, many of the organization now we can able to see that they are telling that all the visitors are not allowed, or visitors, if you are going to be the visitor, kindly ensure that, okay, kindly ensure that you are put the 2 vaccine as our, okay, as our government has been done now. If you are going to, if you want to travel in a train, you have to compulsory, you have to have 2 vaccines, something like that. How we are going to eliminate that? Restrict, yes, we are going to see that also, sir. They are telling that how to handle our external peoples also in this COVID, how to draft a policy for this also. Yes, sir, we can, you can able to demand, you can able to, yes, it is possible that because you are not demanding this. As per our Tamil Nadu government GO, what the GO is telling, only people who have been vaccinated 2 vaccines can be allowed in public places. If that is going to be the case, you can able to tell that as per this guidelines, we are making sure that only if you are going to have only 2 vaccines, you can able to enter inside our premises. Nobody can able to resist, or nobody can able to tell you we are not going to follow it. Because government has been providing that. The same question, if you can able to ask me last year, I would have been told no, because the vaccinations which we have is less, the opportunity is less. Now everyone has been vaccinated, most of us has been vaccinated. So always you can able to ensure that the elimination, how you are going to eliminate. I've been given you a format about the environment. See the environment. Based on this environment, what are the hazards are there? how we are going to mitigate that. Yes, sir, exactly. And even a step further, what I think what we can able to do is eventually, I think you will be having a list of vendors. Okay, you can able to tell all the vendors whoever have been associated with you to have a self declaration in such a way that any person, any employee coming from our end to your firm, they are going to be double vaccinated. We are going to send only persons with double vaccination only. Get a self declaration from all the visitor, from all the vendors. Sorry, from all the vendors. Then all the vendors, they know that yes, it's going to be our policy. So they will also will send the person with this only two vaccination, double vaccination. We can able to have a kind of foolproof mechanism. Next, how we are going to mitigating the risk. First one is eliminating, totally eliminating. Next one is how we are being going to mitigate the risk. Mitigating some of the risk. I always feel proud of our HR person, safety persons, the persons who have been doing much more job in this COVID, the kind of days. We can't be able to entirely eliminate this. We have to have a contact, we have to have a kind of relationship with our employees. So how we are going to mitigating the risk, how we are going to reduce the risk. Okay, that is going to be one of the things. What are the possible areas where elimination is not possible? We always go for the mitigating the risk, but the mitigating the risk always, okay, instead of, I always keep on telling that whenever as a safety professional, you have to, whenever you are going to tell that we need this kind of PPEs, always have a kind of a self evaluation. Okay, good, sir. So PPE stocks. Okay, very good, sir. Good things. I hope it is very good things. I hope after this session, you could have, there is a possible that adding values to this can also be done. So, okay, whenever you are going to tell that we need PPEs, always see that instead of PPEs or instead of administrative control or with PPE, is possible that any kind of engineering control can be deployed. Kind of engineering control can be deployed. It can be one of, it's not only for this COVID, for the entire things which we have been doing on. The next one is about the communication. Communication is a very important things which can able to reduce most of the spreads. Communication protocol or COVID communication protocol, as we have been seen in our chat box, COVID dashboard or COVID a kind of communication. Wow, the kind of communication is going to be there. If any kind of updates, how it is going to reach our employees. If there is any case, I always ask our peoples, if there is any case or any case have been identified inside your factory, how you are going to communicate. That is going to be the biggest thing. And are you communicated their roles and responsibility criteria? I think it is criteria 5. Okay, criteria 5, class 5 in ISO, roles, responsibility and authority. After this COVID, my dear friends, the roles, responsibility and authority of your employees has to add this also. At time of this COVID, at kind of these things. Okay, what is your roles, what is your responsibility, how you are going to engage, how you are going to react with this. Once you have been going to have a clear set of things, so they can also able to help you, they may able to ensure that they can able to add values at time of any emergency. Roles, responsibilities and their authorities. Canteen videos and canteen area. Good, sir. And also, apart from this, thank you. And also, sir, and also what I feel is, okay, what I feel is, if I am a safety officer, what is my roles, what is my responsibility, and what is my authority in terms of COVID? Additional to my usual responsibility, what is my role responsibility towards this COVID? That has to be done. That has to be known to the peoples. Authority in the sense, okay, authority, I just want to insist this word. Authority in the sense, having a kind of decision, okay, having a kind of liberty to take the decision. If I've been authorized to check a person with this rapid kit, yes, he will be doing it. So, roles, responsibility, authority should be clearly defined, not telling that every employee has to do this. Yes, every employee has to do everything. But apart from this, what is your specific roles? What is your specific responsibilities? And what is your specific authority? For example, for our purchase department, for our purchase department, yes, sir, we have to stop our, okay, we have to stop our biometric attendance. Yes, yes, it is good practice. And also nowadays, apart from this biometric attendance, even not for this COVID, which I can able to share you, even to save time, even to stand in the line, you can also be able to go for this face recognition or a kind of virtual reality, VR based attendance system itself. From your CCTV itself, it will capture. That's it. It will capture immediately. It will capture at what time you have been coming on. Everything will be there. Yes, you can. It is possible. Okay, if it is possible, you can able to avoid that, because some of the institution, what they had is they stopped this biometric system, but eventually they started writing in a notebook. I told them, my dear friends, everybody is using the same pen. Everybody is standing in the queue. They are writing their names. It's going to be useful. We have been increasing the risk factor only. So, okay, you have to make sure that because you are the boss of your factory, of your organization, you have to take a better decision how we can able to ensure that, Excellent, sir. So this face recognition, everything, I think nowadays technology has been become most cheaper and cheaper. The only hurdle is how you are going to incorporate this to your institute. That is going to be the biggest challenge. So the real-time basis, as I told, roles, responsibility, and authority, define that. In authority, you have a recap about the policies which you are having on this COVID time. Who is been authorized? Authority is given to declare, or to ensure, yes, sir, to ensure that if anything has been emergencies been happening, who is given this authority? If authority is given, and are they prepared for that? I will tell you one of the case what has been happened. Next one is signages. What are the administrative control you had? How we have been trained our peoples to use the signage. Some of the industries I saw, I've been much worried about this. Some employees, what they are doing is after washing their hands, they are using this the kind of hand sanitizer before they are eating. So we have to make ensure face. Yes, sir. Yes, yes. It is based on VR type, sir. That's good. Technology can always able to assist that. So signboards is very important. How you are going to insist the signboards and how creative our signboards can be to ensure to communicate the things which is being just to be done to our peoples. Next, about the hygiene and safety. What is hygiene and how we are going to ensure this hygiene and safety is the next pillar, sixth pillar. It's about the thermal check. As now we have been saw in our in our chat box. Yes, many of us we have been having a touch-free thermal check has been done. The thermal check, it has to be done to all the visitors, all the guests. Some of the industries inside, whenever a guest is going, whenever I've been going for audit or training, they have been doing the thermal check. Whenever I've been coming out, they are not doing the thermal check. I asked them, why you are doing so? It has to be done, yes or no? Whenever I am going inside, in that 8 hours period or 9 hours period, if I got that, the temperature may be changed. Okay. Yes, sir. It has to be checked in a very periodical manner. And I will give you another interesting fact. Okay, our NVT is doing this kind of research with one of the leading kind of hospital institution. The thermal checks, that the kind of thermal temperatures which is being recorded can be put in a data analytics, big data analysis, and it can be used to predict your immune system and also about your body nature, how well you are. It's in the, I think it's not fully completed. It's in the off stage. Once this thing has been done, eventually we can able to tell that how it can be useful for all of us. Next, defining the process. Okay, defining the process. Okay, hand wash, we are telling that we need to hand wash. What is the frequency of hand wash? Whenever you have been into this ETP, STP, whenever I've been using. Sir, one dish, there are two questions, I think. Time wearing mask or not. Yes, sir, excellent. So it is a facial recognition, sir, virtual reality based system. And also, as Masalamani, as sir has been asked, whether one soap can be done. Yes, soap cannot, I think one soap, yes, soap, whenever you are going to use the multiple soaps, that is not going to be the big cost. Yes, it can be done, but if we can also able to improve upon, instead of soap, we could also able to make sure that some hand wash can be installed, can be, yes, a kind of soap dispenser can be used, so that eventually we can able to increase the kind of hygiene factors, and also it is cost effective also, it is more cost effective also. Oh, good sir, good. So defining the process. Okay, my dear friends, here you have to have a close look. Hand washing, you are telling hand washing. Are you telling that after what are the process you have to do a compulsory hand wash? Think about that. Whenever you are going to get a courier, you are going to handle a courier. Are you telling that immediately you have to do a hand wash like that? No, sir, 21-second hand washing. Whenever I am going to do hand wash, I have to do this 21-second hand wash. That is the procedure. I've been asking that from after finishing this task. Okay, these are the tasks I have to finish. After finishing this task, immediately you have to do a hand wash. For example, okay, I will tell you one of the organization, they told, whenever you are going inside and monitoring and coming out from ETP, STP plant, you have to do hand wash compulsory. Okay, you have to do immediate like that. Okay, like that. You define your process. Put the signboard as is discussed. If you are doing this process, after starting the next process, immediately do hand washing. Immediately do hand washing. If you are seeing a visitor, immediately do, whether you are handshaking or not, do a kind of hand washing. Next, PPEs. PPE matrix should be there, not only for this COVID, my dear friends. I always feel that, okay, I always feel that the PPEs in this COVID aspect, I can able to talk a bit on this. The frontline defenders or frontline warriors should able to have a separate a kind of, yes sir, food industries, yes, it's needed. From first, okay, from frontline warriors, what are the, okay, frontline warriors, we have to ensure, okay, we have to ensure that what are the PPE, special PPEs that are required, how it has to be worn. Okay, many of the things, okay, many of the things I can't able to get a kind of mask now. Many of us, what we are doing is we are wearing a mask. While removing the mask, what we are doing, Okay, wait a minute, I will get a one, so that we can able to know that how we can able to insist our peoples to use a mask in a right way. And also you have to have a kind of a matrix in such a way that what are the PPEs they have to warn. For example, if a COVID case, okay, if a COVID case has been identified inside your factory or organization, a person who is going to have or help that person, what are the PPEs he has to own? What are the PPEs he has to own? I will tell you a very interesting thing. Our institution, our organizations, all your organization is having much higher PPEs than anyone else. Already we are having it. Okay, already we have been having it. How we are going to use that? Can I, okay, in that time, can I able to know? Can I able to know from you a small reflections? The scenario is this: a person has been identified COVID positive inside your institution, inside your organization. What are the PPEs you are going to recommend to the person who is going to come with that COVID positive and bring that patient to the transport that patient to the hospital? What are the PPEs we can able to recommend to that person? Kindly put it in the chat box. As I told you, isolate. Okay, we have to isolate the person first. Yes, we are going to isolate that person. We are going to send that person to the isolation room. That's very good. But N95 good. Okay, apart from N95, what about our cartridges? Eventually, I will tell you. Okay, I will tell you, if you are going to have self-contained breathing apparatus, the person who is going to rescue or going to transport that person to the hospital, tell the person to put full body coverall as you told, and okay, the PPE kit. Okay, you can, the person can able to put the full body coverall. Okay, why he or she has to take a risk of putting N95 or all these things? Okay, connect a SCBA. 45 minutes is going to have. Yes or no? A kind of disposable gown, yes. And eventually, okay, even okay, if you are not going, to have a disposable gown, also, we are going to have a chemical suit, yes or no? A kind of chemical coverall. We can able to wear it is double layer protection. You are going to use your SCBA. Tell your person to use the SCBA. If he can able to use the SCBA, nothing is going to happen. Is that right? So I always tell that industries, we are having everything. Everything is it's been there. The same thing cannot be followed in hospitals because SCBA is a very SCBA is very costlier one, and we cannot opt this SCBA for everyone. But if it is in our industries, you can able to use all these things. Okay, coming to this PPE, how to use this PPE? Many of us, what we are doing is, while disposing our in our lunchtime break time, they have been folding this and they are keeping in their packet. Yes or no? First thing, you should insist your employees not to do this. Next thing, while removing any mask, N95 or 2-layer, 3-layer, any mask, eventually you should tell them not to remove like this. Not to remove like this. All the, not only COVID virus, all the toxic substance will be in this area only. If you are going to do like this, instead of all the toxic substance going in this way, it is going in this way. So you have to ensure, okay, you have to ensure that how they are going to use, the PPEs, and how they have been going to use the PPEs and dispose the PPEs in a right way. PPE metrics, put a PPE metrics for COVID protocol. Eventually tell them, Yes, sir. Yes, Nandagopal sir, we are going to see that. The disposable is also one of the pillars about this. It is about the PP. So here, short and sweet, I'd like to tell your safety officer, or you are going to be a safety officer, think about, put a PPE protocol, and also all your PPEs, I will request you, all your PPEs should have, okay, sir. I will repeat you, whenever you are going to put a mask like this, okay, mask like this, while removing the mask, always it should be removed from this way only. Don't keep your hand. It may be a bare hand. Some people will tell that, sir, I'm putting a gloves, I'm keeping like that. Don't allow. Always it should be where, and also it should be removed in this way only. Don't keep your bare hand like this and remove. And also don't fold this, keep it in your pouch or in your pocket. It is going to be more hazards. The first layer, the front layer is going to be the very dangerous way. If you are saying that, sir, my people are using a cloth mask, don't worry, tell them, remove like this, put it in a soap water. Don't ever touch the front part. It is not going to be useful at all. And also, last thing I just want to share here is the PPEs which you are going to use. Okay, you have been used. Always have a EN number or IS number. Make sure that it has been compromising the legal requirements. It has been compromising the legal requirements. Next one, hygiene and safety. We are going to see about in same hygiene and safety. We have been calling about the cleaning agent. What cleaning agent we used? Okay, after this 2020, many of the industries started this cleaning agents. We can't be able to count the names also. You have to ensure that if you are going to purchase a cleaning agents, you have to get their SOPs. How much of water? What is the protocol? Safety data sheet. That only has been rightly told by one of our participants. Thanks for that, sir. Safety data sheet. What is the safety data sheet? Are your product have been getting the safety data sheet? Get the cleaning agents only which have the safety data sheet. Ask them. It may not be an acute danger, but it may be a chronic danger. For someone, okay, it may cost some 10 to 20 rupees extra, good, but don't take a risk. Ask him. Okay, you can able to ask your purchase people, my dear friend, I need a kind of safety data sheet for the cleaning agent I need, and ask their SOP. How much of water has to be put, whether I have to put water or not, what is the safety guidelines, everything has to be done. Next one is about the awareness. Nowadays, okay, how you are going to spread this awareness among your employees if they are not well, if their spouse is not well, children is not well, how they are going to take care about them. What about the self-isolation? What is the quarantine rule? Because the quarantine rule nowadays has been changed. But very important thing, the support which you are going to give to them, a mental support, a psychological counseling, a psychological kind of support, that is going to be more important. In this hygiene and safety, next important point I like to discuss is disinfecting places. Yes, we are going to apply this cleaning agent all the areas, but my service team has to identify the highly risk a kind of infecting areas. As I put the handrails, public encounters, the kind of telephones, all these areas, it needs lot more. The frequency should be improved upon. The cleaning agent should be put, and it has to be ensured that these places has been disinfected very frequently. About the hand wash, yes, as already we have been told this. What about the hand wash? Previously, we talked about the cleaning agent. Now we are talking about the hand wash. Ask to this person, one of, okay, in my firm, okay, in my institute, I've been asked that person who have been given this hand wash, what is the safest, okay, how many times, or what is the safest ml I can able to use this hand wash per a day? Or is it okay? Or is it good for all types of skin? Or for which are the activities I should not use this hand wash? Something like the guidelines. And whenever you are going to provide hand wash, provide it in adequate way where all the employees can be assessed and they can be used. And about the sanitizers, same thing. Sanitizers is more important. Hand wash, at least we are doing a hand wash and we have been cleaning it with water. But sanitizers, as I told you, they have been frequently it has been used. Okay, frequently it is being used. So are your sanitizers is having 10 ml per time? Oh, good, sir. Good. Difference between hand wash solution and sanitary solution. Okay. Sir, hand wash solution, whenever you are going to talk about hand wash solution, hand wash is for our human contact mostly. Yeah, humans can able to use that. Okay. Sanitizers, whenever you are going to sanitizers, whenever you are going to talk about hand wash, we are going to, instead of soap, we are going to use this hand wash. Sanitizers, yes, it's a soap kind, but instead of water, okay, instead of water, a sanitizer can able to do the job. It is a different. A sanitizer will evaporate. It's instead of water, instead of a kind of water conservations or okay, eventually the main objective is we humans are we little bit lazy. Instead of going and washing our hands, immediately we can able to use the sanitizers. So this kind of sanitizers culture has been came upon. Next one is social distancing. Yes, social distancing. You eventually lift, pantry, canteen and pantry. You have to be more careful. Okay, one of the firms I just who don't want to name that they have been followed a very good protocol. If I think two security is coming, taking the pulse level and seeing that everything is done very good way. But in their canteen, everybody is sitting together. 4 to 5 people is sitting together. I asked the person, HR person, sir, you've done a very good job. But why can't you provide a shield, a small shield, a kind of acrylic or even a kind of a shield in such a way that each person can't able to see and okay the kind of a spread can be controlled, or even you can able to insist, yes sir, a kind of zigzag schedule can be provided. So okay, these are the things, okay, these are the things I always feel. I also will I will communicate this to the INVIT team also. I told them the best practice of each industries has to be spread throughout, okay, throughout our Tamil Nadu. Because, for example, if a Sunland team is if have been took initiative, innovative kind of thing, why not it should be spread? Sir, we can't be able to benchmark the usage of sanitizers based on the liters or mls, but my consideration is it's due. We can't be able to tell this much of quantity is going to be okay. We need this much of quantity, but it's based on the trial and error method only. First, as if your question is based on number of the litters is only based on trial and error method only. But my intake, my objective is what is the safest time or safest time, okay, number of times I can able to use it per day. That is my biggest question, because I can't be able to use 100 times. You have to ask this to the provider. I've been asked the same questions to them. They told that, sir, we did not test. I told them, yeah, okay, we need a test. For example, if I've been using, if a person is using the hand sanitizer for 50 times a day, if something is happened, who is going to be answered? Then you should not tell me that, sir, this is the safest limit. So tell me, okay, tell me what is the so it can't be done, sir. Even your IS auditors, you can able to tell to your IS auditors, sir, it has to be, okay, it has to be benchmarked by, it has to be given by the supplier only. How much ml? How we are going to calculate the ml? Per press. What is the ml it is coming? What is going to be the safest press? We can able to keep it in that way. Next one, social distancing, as I told, inventions. Okay, let's have a forum. I will discuss to this INVIT team also. Let's have a common forum. So every week you can able to share your inventions, innovations. So it's always, yes, sir, sanitizer will have allergy. All these things has to be get. We have to get all this information from their providers. You give this responsibility to the purchase team. Okay, list out your requirements. My dear friends, my dear friend, I need all this. You get all these things to the provider. There will be two things will happen. One thing, the person is having a good quality product, can able to answer all this question. Or other way, the person who does not know anything, don't come to you at all. Yes or no? He may be frightened. He may think that why these persons are asking this many questions. So the standard is very high. So it is always good that we are skipping this company. That is good for us. Okay, instead of buying a product from a person who is not knowing all these things, we can able to buy a product from a person who is knowing all these things. The next one is a preventive measures. The preventive measures, how the isolation facilities, communication, display of emergency contact numbers, isolation facilities you have been mentioned. I can able to see it in our chat box also. Isolation facility. We are having isolation facilities, sir. Very good. In your isolation facilities, what are the emergency measures we have? Are we having a ambo bag? Are we having a kind of small oxygen cylinder? It's needed, yes or no? It's needed. If something is going to wrong, it's been going to be wrong, we have to do all these things. Are we having a kind of small structure there? If you are going to have a AED, okay, if you are going to have a AED, put that AED in that room or nearer to that room, something like that, to ensure that any emergency, we can able to react very fastly. Next, are we having a emergency contact numbers for COVID, exclusively for COVID? Are we having a emergency contact number? Are we? Yes, you would have been tied up with many kind of hospitals. My biggest worry is frequently contact them, ask them whether they are having same kind of facilities, same kind of care which they have been given in first wave also. Always make sure that, okay, always contact them, always make sure that, yes, excellent, sir. Good. Oxygen cylinder. That's a, as you have been told, Raj sir, our side we have ambulance with oxygen cylinder. Also ensure, okay, always and also ensure that the ambulance driver or the caretaker is being trained in that also. Have been trained in that also. Whether he is being trained in this to handle a patient who've been COVID affected or any type of emergencies also. This is one part. Next, you are having a hospitals nearby. Are the hospitals? I have been repeating the same things. Okay, I'm not against any hospitals. Even many hospitals, I've been a part of the NABH team, the quality team. But eventually, you have to ensure. Okay, excellent, sir. Emmanuel, sir, excellent officers advice. The last, okay, at the last of the session, I will tell you what is the proactive thing we can able to do to protect us from this COVID. So here I just want to add something. Okay, the hospitals which you have been tied up at least 2 weeks once. Uh, okay, ring them and ask them what are the additional facilities they have been provided, how many doctors they are having, because we have to ensure that the same care which they have been given on the first wave, it has been continuing or not. Next one is about the incoming goods. How we are going to handle the incoming goods, that too particularly our security members, how whether they are going to accept it or not. That's the first thing. A kind of most inspected, or it is a red. Okay, nowadays it is not red zone, but if it is, first the protocol should be whether to accept it or not. Next, if it has been accepted, how many hours I have to keep it without giving to the concerned person. How I have been going to disinfect this. Next, as we saw, adequate PPEs. Adequate PPEs, the PPEs which we are wearing, there are two types. There are NRP. Whenever you are being going for this, okay, a kind of US standard, the mask we are going to rate it on NRP. N for non-resistance, R for resistance to oil, P for oil proof. If you are going for N95 P type, it is going to go for, we can able to use for 40 hours. It has been going to be NRR, it is going to be only for 8 hours. So are we ensuring this kind of things, or this kind of updations, are we giving enough PPEs to them? Next, what is the enteral control system? In the entrance, how, yes, nowadays many of the organizations have been reporting this, and also reporting the COVID positive cases. What is the protocol of a person working, or a person now is being not in the job, is his relatives or his family members has been turned into COVID positive? What is the protocol we have been having it to ensure that, okay, to ensure that they are not turning into the hospital on next day? These are one of the most important thing. Next, monitoring. Very important thing about training and awareness. Training and awareness. Yes, many of the institution, 1 to 7 pillars, we have been implemented in a right way. But training purpose, there should be exclusive training for COVID-19 awareness itself. It should start from their health, why we are doing all this, talking about the SOPs, and by following this, what are going to be the benefits. That should be the case, and they have to understand, okay, they have to understand this. Okay, sir, currently people don't show, yes. Okay, thank you, sir. I think today is 30 plus awareness training is going on good. Sir, here, the case now they have been telling that the temperature is being not, that as you rightly tell, temperature, we can't able to measure to the kind of temperature. But whenever you are being going to have a close or effective this relationship with your employees, if they are not well, okay, they are not well, a supervisor can able to easily identify. Even myself, before this I think before this Pongal, 3 days, I'm not well. But there is no cold, there is no fever. But eventually I can able to feel that I'm not active. Whenever we are not perfect, we can't be able to bring the kind of thinking in the process. So I took 2 days, a kind of rest, then I'm okay. Like this, the supervisor has to observe this. Can be done in that way, or The employee itself, they have to be more loyal to, okay, to our organization. If they are really, they have been not well, not sick, always they can able to go for a leave. But they should not use this in a wrong way. No other way, sir. No other way. They're not, even our government is not telling that if you are having fever, slight symptom, don't even go for COVID test. Yes, sir. Our government is telling this double vaccination is compulsory, as you told yesterday, for the family members also. Self restrictions, even you have to okay, that's why I'm telling that whenever you are going to draft, okay, now we have been here that 30 of our people have been undergoing a COVID training, that you have to split up this training. Don't ever put that these are the things you have to do. No, first you have to insist why it is necessary. Before, I always feel that, okay, this is the thing is been not given here, but I always feel that all the SOPs should be drafted by the working persons only. Then we can able to fine tune, and then we can able to fix. If that can be the case, accept, adapt, and apply can be happened in the industry. Participatory management class ISO 45001 is asking about. Participatory management class number 5. How well we have been utilized. Next about preventive measures. Preventive measures, even okay, most of the institution have been part of this immunity. Last year, this year we are doing COVID mock drill, COVID emergency mock drill. Whether they are trained, whether they are having this self-confidence, whether they are displaying, whether they have been exhibiting all the things supposed they have to do. Do a mock drill. It should not be done, okay? It should not be done by us. It should not be done only by us. It can also be done by our institutions or okay, by your organization also. Check them whether they have been much prepared or not. Okay, sir. Times COVID mock. Okay, COVID mock drill is nothing but, sir, I will tell you as a gist. You can also see that COVID mock drill in the InVT channel also. The first thing you can able to see, you would have been defined all the roles, the responsibilities, who is going to be the chief, a kind of examiner. You are going to tell that, okay, one person so and so is being COVID positive. That's it. You are going to observe all the frontline warriors, how they are reacting. Second, that batch alone, okay, don't create this panic throughout the company. It's not good. Towards that unit or only, you are going to observe what they are doing now, whether they are following the protocols which is being given by you. If it has been not so, what you are going to do? You are going to train them. There may be, yes, you are going to have a well-defined policy. Yes, it's going to be we are going to do like a mock drill only, but not like fire mock drill as a unit, because if you are going for fire mock drill, again we are going to keep all the persons, and again we cannot able to spread, we can't able to follow the mock drill a kind of physical distance and all. It can be done in one unit. Then that unit report. Yes, sir. I think your ISO 45001 certification body, they have been a very good body. From which body you have been doing is, sir? If it is possible, you can able to put that also. Very good. That should be the case. Okay. So you are going to observe all these things, and you can able to prepare a report. From that, you can able to see what is the gap analysis. That gap analysis you can able to spread to all the units. My dear friends, we conducted this kind of COVID mock drill. This is going to be the situation. These are the areas we need to improve upon. Seriously, we have to improve upon. The same way you have to immediately, okay, same way immediately you have to talk to your emergency team also. My dear friends, like COVID case mock drill, we done that. These are the areas gap has been found out. Why the gap has been found out? Are you need of any kind of support, any kind of any kind of resources? If it is so, then we can able to incorporate it. So they have been well prepared for this. In this training, I will also ensure that yogic practice, pranayama. I think after this 2022, 13 institutions, 13 organizations, their healthcare centers have been associated with this INVT yogic practice. So it's a proactive thing. Whenever we are doing a kind of pranayama, a kind of yogic practice, or anything, okay, any kind of exercises, it can also be incorporated with the health sector to ensure our peoples, our employees have been proactively, they have been well fit. Next, waste management. Yes, it's been asked by one of our participants. What is the waste? How we are going to dispose the waste? Sir, the waste should be handled very safely, and you should be able to have a color code in the sense you should be able to have a color codes in such a way that all the PPEs which is being wear, it should be disposed as a biological waste only. Again, I can able to tell you the PPEs which we are wearing it should be disposed as a biological waste only. You should be able to have a color coding bin should be there, and you have to ensure, okay, you have to ensure that it should be disposed in a very right way. It is for us, it is for the environment, it is for the other human beings also. Okay, it's a kind of other living beings also. We have to, in the training, you have to insist your peoples how to dispose it also. I'm seeing, okay, I've been hearing many of us, even in my house, okay, they have been going out, they are keeping their mask inside our room, okay, inside a living room. Yes, sir. Biological waste, it should be a biomedical waste only. It should be treated like a biomedical waste only. It should be put in a, okay, it should be collected and it should be given to the proper persons who've been identified by our Tamil Nadu government. Or else, okay, or else some of the big factories, they have been having a kind of own setup where they have been, okay, where they have been disinfecting it, but it is a little bit costlier and more procedures. We need more procedure for this. Thank you, sir. Thank you for this, Balasubramaniam, sir. So the things is, it should be a color coded one. There may be possible. I can able to tell you before this COVID, a mask, gloves which we are using is not considered as a biological waste. Yes, that's what I told, sir. If you are going to burn, you have to have a special license for this. The napkin pads, usually we are going to burn this good. But for this PPEs which we are using for this COVID, time of COVID, they have been asking that whether you are having a permission, whether you are having a protocol. What I personally feel is it's always better you can able to give it to this Ramki or whatever the vendor who has been approved for this. Okay, give them. Already you will be having a MOU with them, a understanding with them to collect their disposables. Same way, the same person can also able to handle this. Tell them, okay, weekly once come and you can able to carry out this. Thank you, sir. The next one is going to be the frequent cleaning. How you are going to clean? It's not okay. Earlier we talked about cleaning about the workplaces. Here we are going to talk about the cleaning of the garbage section, dustbin, trolleys, vehicles. Even okay, I can able to share you next best practices. If it is possible, kindly follow it in your industry. And after following it, to my satisfaction, you can able to take a snapshot and send to the INVIT team. Every bus should able to have a mask disposable or any disposable bins. Is it right? At least do it, because it is one of our responsible. Because many of us, yes, sir, it should be a red color. It should be a red color. And my request, humble request, is kindly provide one bin in your bus. At least they can able to use that. Some of us, I've been seeing that in the roads of OMS, eventually they are putting their mask, gloves in the roads. The persons who are going to clean, they are also a kind of human beings like us. Whenever they are doing it from our bus, it looks very awkward. Very awkward. So signages you can able to put, I can able to send the signages also. You can able to put as all the PPEs, own PPEs can be disposed here. This mask, it should be, okay, it should be mask and gloves. More items we will be getting is mask and gloves. Next, we have been going to see about the ventilation. Very important thing, ventilation. How the ventilations is been arranged. How the ventilation purpose has been arranged. Actually, I will see this in two ways. This ventilation, I will see it in two ways. The first thing I can able to see that, yes, eventually long hours sitting in air conditioner is not good. At least whenever you are going to make sure that you are going to ventilate, see for what are the different types of other ventilation, natural ventilation you can able to bring on, or if they need air conditioner, how you are going to maintain that. It should not be a closed compact room. Okay, that can, okay, it can be ensured. And how it is been, okay, the kind of exhaust system. There is a, okay, sir, that's good. We can monitor. There's, yes, CO2 ppm also. Okay, that's one of the very best practices. Okay, I've been very much happier about this webinar. A lot of two-way communication. So many of us can able to benchmark the best practices. I am also learning a lot of new things from you. Thanks for this involvement. So the maintenance of the utilizers and also about how we are going to maintenance the exhaust systems. It is also one of the requirement. Next, we have been going to the pillar called public interaction and supply chain. Public interactions and also the supply chain. How you are going to communicate to your employees about the public interactions. You can't be able to tell, okay, I will tell you another thing also, a caution thing also. We can't be able to tell them, don't go for any public interaction, gathering and all. They won't listen. Or it is very difficult because we as a person, we can able to be as an employee of your firm, I can able to listen to you, but we can't able to restrict that to the family members. But at least you can able to give a protocol, yes or no? 2 masks, something like that. 2 masks, put a, okay, gloves before coming, okay, before going, what are the things you are going to do that. After coming from a marriage, what are the things you can able to have a steam inhaling, you can able to put, okay, for the last 2 years, okay, last 2 years, this restrictions, this lockdown does not affected me at all. Keep on servicing by God grace and also by all of your supports. I've been keep on running only, keep on serving, keep on doing, keep on training, auditing. I've been going to my college, everything has been done, but the with safety protocols. Whenever I am going outside and coming, doing pranayama at morning, regular, going outside and coming, doing pranayama and taking a kind of steam inhalation with me. It may or may not. Sure, sir. Sure, Balu, sir. PPT will be shared to all of you. I always feel that all the information has to go to all the peoples. We should not restrict only with INVT or only with Satyanarayanan. It has to be done with everybody. and also you will get a checklist also. You will get a checklist. You can able to use this checklist also. So make sure that you are keeping your employees aware about this. Supplier communications. What type of supplier communication? If your supplier is coming to you, whether a supplier has to come to you, it is mandatory, or Zoom call, in Zoom or in the online itself. Thank you, sir. In the online itself, we can able to do all these things. As a safety, as a HR person, keep a protocol to your the kind of purchase team or all the teams who have been handling the supplier. You have to have a protocol in which measures they have to visit your plant. If it is not required, don't ever call them, or don't ever tell them they can able to visit your site. Next one, very important thing about transport management. About the transport management, there are another 3 slides only. We will finish it as per the schedule. So the transport management. What is the transport management? Because most of our firms have been operated, we have been operating a kind of transport, our office transport, our industry transport. Are your drivers have been aware about all these things? Or you are telling your drivers you should not go for drinking tea, drinking water from all these places and all. Before COVID, it's okay. After COVID, you have to create this kind of awareness to them, because they are the primary persons. Tell them, make sure them they are one of the very, very important persons which we have to train them, make them aware. Yes, sir. Movement should be restricted, and also not only inside our shift, sir. Inside our shift, they should not roam inside our facilities. That is one part. Next part is after the duty also. After finishing the duty also, we have to educate them. You can't be able to go anywhere like you are going. Okay, before this COVID, for tea or for eating your food, there should be some protocol. Always wear a mask. If your friend or somebody is not well, immediately you can able to disclose to them. If you are not well, again, a very biggest thing. Okay, one of the industries we have been faced. Early morning, 2 of the drivers have been not well. How the particular route peoples can able to bring back to the industries, bring to the industry for the daily work? Are we having a plan for that? After enquiring that, the driver is telling, sir, I'm 2 days not well, I can't be able to tell. I've been much afraid to tell this to my management. Somehow I am being managing. It should not be the case. And once the shift, once the morning shift, tell them to have a disinfection. Tell them to clean the vehicle. Tell them to dispose. As I told you, to keep a dustbin. Tell them to dispose. Tell them to wear a mask, proper mask, because they are one of the persons which we have to keen on. Next, documentation. Yes, my dear friends, you will be having a lot of documentation. Very good. Make sure that who is being authorized for this documentation, who is going to monitor that, who is going to record that, what is the frequency of monitoring that. That should be very, 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 very important. So in this 14th pillar, I just want to tell you that list out the documents and records you have been using for COVID. You will be having a number. Very good. Eventually put that who is responsible to maintain that record. Very good. Next, what is the monitoring frequency? Okay, sir, it's a very good question which you asked there. Temperature, as I told you once again, if you are going for temperature, you can also able, if temperature is, because in this time temperature check may not be effective, you can able to check for the kind of oxygen dissolution, oxygen pulse meter. You can able to check the kind of oxygen pulse meter. But eventually I feel that it may be oxygen, it may be this temperature, whatever it is, the main important thing is it should be come from each employee responsibility. If you are not well, don't come. Why you are been spoiling others also? As your question, it can be the kind of oxygen cones, oxygen pulse meter can be incorporated if possible, sir. If possible. If it is a very huge crowd, it may not be possible, but you can able to look for that also. So the last part, last pillar I just want to discuss you is about the control of discriminancy. Yes or no? Okay. The thing is, don't see the people who have been affected in COVID in a pity way. It's not so. Yes or no? Everyone will get COVID one day or another day. It's going to be like a common cold or madrasai, which everyone is seeing that. Don't see them as a kind of a pity person or person who have been done some injustice. Nothing like that. They are also our employees. Okay, the training part which you have been told, okay, which you have been going to teach your employees, it should also include this. Yes, sir, it's a part and parcel of life. Good. So, as a conclusion part, okay, before concluding, if you are having any doubts, you are being welcome to ask me. It's always you can able to put it in the chat box, or you can able to ask me. If possible, I can able to tell, or otherwise, I can able to refer and I can able to send you a mail. And as a conclusion part, these are the two things which I always insist you upon. Kindly make sure that the moral boosting, immunity boosting, and financial challenges. These are the three things. Leadership is a matter of having people look at you and gain confidence. Yes, sir. The kind of moral boosting should be there. How you are going to support your team, a kind of immunity boosting, exercise, a kind of meditation, foods. These two things is very, very important, because a kind of other things which we are doing, providing this mask, providing is good, it's active. What is the proactive things? The kind of moral boosting, immunity boosting, as I told, immunity, they have been part of 15, I think 14 of the health centers to ensure this yogic practice, exercises, food, good foods, what are okay, how the kind of food can be suggested to ensure our peoples have been. Are we as a institution, it is our responsible to increase the human level of my employees. What is the things we are going to take upon? Yes, sir, avoid smoking. Yes, it should not be only prescribing. What we are going, how we are going to induce them to them. As I told them, if it is going to be a yogic practice, if it is going to be a small exercises, then we can able to ensure that it is being practiced, and we have been giving them the way. We have been giving them the way itself. Yes, this should be done and this should not be done. So they can be much aware about all these things. And at last, if you are having any questions, I will put you the feedback links. Kindly ensure that you have been registered, you have been filling this feedback links to ensure you have been getting this entire slides and also the checklist which we have been talking about. Any doubts, any clarifications, you can able to put in the chat box, or you can able to open, you can able to unmute yourself and you can able to talk upon. And also thank you. Yes, sir. Today presentation you will get, sir. You will get without any doubt, because all these things has to be shared among our peoples. There's no point in such a way that we have been keeping this with us as a closed copy. Checklist, yes, sir. Checklist. We are going to give you everything. I will put you the chat box. I can able to put it in the chat box so that we can open that file and you can able to see that all the things which we have been discussed. Thank you, Emmanuel, sir. Any doubts? I think feedback form has been linked, has been put in the chat box. You can able to click that. There are two feedbacks. Kindly ensure that you can able to fill the two feedbacks which has been posted there. Any doubts? You can able to ask me, sir. Thank you, sir. The feedback form is been posted as attachments. As attachment, it is being posted to you. Okay. Or otherwise, I can able to put the mail ID also. You can able to mail them. Sir, about the booster dose. About the booster dose, I think I am not a kind of professional to answer this. I will, okay, surely I will discuss with the doctors who have been associated with INVT, and I can able to chat. And also about this, okay, I will tell. Wait a minute, I will tell my colleague to put the feedback link in the chat box. Okay, sorry, sir. The normal, actually, you have been asked two questions. What is the chemicals which we can able to use as a disinfectant in our buses? The kind of normal chemical is sodium, which we have been using on. It can be okay. It can be used. And also about the next questions. Yes, the feedback link has been posted. Thanks for that. The next one is about the temperature. Yes, we have been doing a small research with two medical institutions. There are studies which we can be concluded by having a temperature of a person for more data for 90 days, 100 days. We can able to conclude at least not a immune system directly, but about the psychological factors, and based on the psychological factor, how the immune system is going to be done. Is it fine, sir? So fine. The next week, yes, I got information. Next week, we have been going to have a next interesting subject called a kind of umbrella, which about our environmental, about a kind of air, what is the measures which we are being going to take of, which we have to take for an industry. It also is going to be a very interesting session. Also, thank you and thank you for this wonderful opportunity. I thank INVT for giving this wonderful opportunity, and also the timely topic which is being conducted, and thanks for that. kindly fill the feedback form and review, and to ensure that this kind of good things has been transformed throughout our peoples, throughout our country. And once again, thank you. And also thanks for our Balu sir, and also thanks for Unni Krishna sir, and also thanks for others. Actually, you have been made this session a very memorable one. And also thanks for our Masila Mani sir, who have been keep on asking lot of questions, lot of inputs. Sir, everything Unikrishnan sir, as I promised you, it's not only for this session. All the sessions in VT which they have been posting, all the slides which they are using, it will be shared to the peoples. Kindly fill that form, that feedback form, and also you can, if you are been ready, you can able to give the review. So in such a way that everything will be followed. The ultimate aim for this industry empowerment session is transforming the knowledge, sharing the best practices of one industry to the other industry. Let us join together in this pandemic situation. Let us work together. Let us save the life, and let's live a very peaceful life. Thank you. Thank you once again. If your colleagues, thank you, sir. Thank you, Lord, sir, for your kind words. If your colleagues, some of us have been mixed this session, they can able to see all the session in InVT YouTube. InVT YouTube, it has been recorded, and it can be, you can able to share that, so they can also able to ensure, because in this pandemic situation they can able to develop a proactive measures to save the millions and millions of life who have been working in your factory. It is our social responsibility. Sure, sir, we will eradicate. It is a effect. We can able to see this. Okay, see this, because I will tell you. Okay, last time they told that, sir, there are 120 registrations are there, but very few persons have been attending. I told them, don't worry about this. We will do it, because it is one of the thing which has to be done at this moment. At this moment, good things has to be spread. The thanks has to be given to our Quality Council of India, to our nation, to the peoples who have been developed this standard. I am just a bridge, invitee, or initiated that. And thanks for your valuable time on this Saturday, on this weekend. I hope we have been spent this time in a right way. Thanks for this. Thanks for this opportunity. Once again, have a safe day. Make sure that we are protecting our family members and also our employees from this third way. Let's be proactive, and also advance Jan 26, our Republic Day. Wishes to all of you. Thank you all.
Thank you. Thank you, sir.
Sir, thank you, sir. Thank you, sir. Thank you for your kind words. It's a very good session we had.
Thank you very much. Thank you very much, Dr. Satyanarayana.
Thank you, sir. Thank you all, sir, for your kind words. Thank you.
ഹലോ ഏതാ ഏതാ ആ ആ ഞാൻ കണ്ടു വായിച്ചു ആ ഓക്കെ അതിൽ ഫോൺ നമ്പർ ഉണ്ടോ ആ ആ ആ ആ ഞാനിവിടെ നമ്മുടെ ഇവിടെ കോട്ടയം റീജിയണൽ ഓഫീസിൽ പോയിട്ടുണ്ടായിരുന്നു ഇതിന്റെ എന്തായി